Hello, my name is Jane. I'm the lead physical therapist here at Alliance Urology. I've been a physical therapist since 1990 and specializing in pelvic health since 2015.
My name is Deborah. I'm a physical therapist assistant, and I've been here at Alliance Urology since 2013. Today, we're going to go through a few questions that are commonly asked so you know what to expect when you come to see us for pelvic floor. What is a pelvic floor?
So, your pelvic floor include muscles that are positioned underneath your pelvis, and they serve as support to your lower abdominal organs, and they help control your bladder, your bowel, and your sexual function. A day in the life of your pelvic floor would include your muscles contracting when you need to hold back that pee or poop, your muscles relaxing for you to be able to empty your bladder or your bowel, and they help balance with your hip and your abdominal muscles to stabilize the pelvic floor, like when you work out or lift your children or even just with walking. They act as a counterbalance with your diaphragm and your abdominal muscles to help regulate the pressure in that lower abdominal area.
Why would doctors refer to pelvic health? What kind of things do you treat?
Some of the more common things that we treat would include bladder issues such as urinary leakage, urinary urgency or frequency, poor emptying, painful bladder syndrome or interstitial cystitis, bowel issues such as constipation, fecal leakage, and any person that has pelvic pain that would include pain with intercourse, testicular pain, or other pelvic pain. It can include people that have endometriosis, pre and postpartum patients, or lots of other pelvic health disorders.
Do you see only women?
No, we treat any gender, male, female, transgender. We are happy to work with anyone that has a pelvic floor. We don't discriminate regarding any gender identity.
I'm a little nervous about coming to therapy. Could you help me feel a little bit more comfortable with the idea?
Sure, first of all, note that we don't perform surgery or prescribe medication. We aim to provide non painful treatments and give you plenty of time to ask questions in each session. Our overall goal is basically to get you back to doing what you love. Know that you're not alone. Most people out there are seeing pelvic floor therapists with your same kind of issues. We use a private room to treat you for approximately an hour each session, and we're all highly trained and very compassionate therapists. A lot of people tell us they're nervous about having an internal exam, but it wouldn't necessarily be on your first treatment, and not everyone needs an internal exam.
Well, then what should I expect for the first time?
The first session would include the therapist getting some information on your issues, giving you lots of information regarding your problem, explaining the anatomy of the pelvic floor, and giving you educational advice on things that you could then do at home that may help your issue. After that, we would do a brief evaluation looking at, say, your posture, your strength, your balance, and how your pelvic floor is functioning. Occasionally, we would perform an internal exam of your pelvic floor muscles on that first visit, but this would certainly be with your explicit consent. And not everybody's ready for this on the first session, so it would be tailored to meet your individual needs. We would give you exercises for you to start working on at home, and everything we discuss or do provide you would be in writing for you to take home that day and for any future sessions.
What do I wear? Do I need to shave?
For the first visit, it may not be really important what you wear, but after that, you would want to be in fairly comfortable clothing. We will be asking you to exercise. We understand if you're coming from work that that may not be possible. You can always bring a change of clothes, and if you can't do that, we'll accommodate however we need to. We really could care less whether or not you have hair in your legs or in your private parts.
What if I have my period?
That doesn't make a difference either. Again, internal treatment doesn't have to be part of the session. We have lots of other things that we can work on.
Can I bring a family member or a friend or a partner? What about my kids?
We're happy for you to bring an adult family member or partner. We do discourage you from bringing small children unless you are postpartum and need to bring your infant, because all of the topics we discuss may not be child friendly. Also, we want to focus on you and your health care versus chasing your little ones around.
Where do I come for physical therapy?
Well, first of all, make sure that you come at least 15 minutes prior to your appointment. Parking at Alliance can certainly be challenging, and for new patients, it takes a little longer to be checked in. For those of you who haven't come to Alliance, you will check in at the kiosk on the second floor and you'll be directed from there. But for those of you coming from a doctor at Alliance, you'll just check in at the kiosk like you do for your regular doctor.
How much do I have to pay for therapy, or do you take insurance?
So, most private insurances cover outpatient physical therapy, but to be sure, you can call your insurance carrier regarding your specific plan or your copay. If you're paying out of pocket, you should call the business office to ask about payment. Unfortunately, we do not take Medicaid, so if this is your primary insurance, we can give you referral for places that do take Medicaid.
What should I do if I'm still uncertain about therapy or if I'm thinking about canceling my appointment?
Just call us. You may have to leave us a message, but a therapist will call you back when we're not treating patients, and we're happy to answer any questions you might have. Our phone number and our information is listed on our website. So we look forward to seeing you then.